Welcome back. It is back to school time, and we want to make sure you and your kids are prepared for a healthy and safe year. Many kids across the country are going back as COVID is on the rise in different parts of the U.S. ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel, is joining me now for more on this and what parents should have on their school checklist as they start the school year. Dr. Patel, always great to have you. You know, school districts in Kentucky and Texas have canceled classes amid a surge of illnesses, including COVID-19, but not just COVID. So what do parents need to know about the chief concerns right now?
Well, in some of these school districts, Diane, they're in areas where COVID cases are on the rise. And in some places, staff are actually getting sick and they're having to shut down some classes. So parents should know that when you get kids together, your risk of spreading communicable disease, that's disease spread from person to person, goes up. This includes influenza, COVID, stomach viruses, all of it. And there's still some unknowns about COVID, including what's going to happen with the new variant. So it's important that parents pay attention to all headlines. And guess what? Same rules apply when it comes to testing for and detecting COVID. So tests still work right now. So does vaccines, so do masks, and also hygiene is really important. So make sure your little ones have a game plan when it comes to washing hands, covering their mouth if they have to sneeze. And as always, if your child is sick, have your child stay home and stay away from others.
How much of this is just accepting our fate and realizing that anyone with little ones is just going to have one member of the family have a cold for the next, 9 months?
That is just going to happen. It's just like a continuous rotating door of viruses. You got to be prepared.
It really is. All right. So kids often also have a lot to carry in their backpacks. How much weight is too much for them? What do parents need to watch out for on that front?
Well, the first thing I have to say is I'm thinking about this because Alora, my daughter, is already wearing a little backpack for toddler preschool. I can't. My heart melts.
My goodness, she's so cute.
This is it right here. This is her little backpack. It's the most precious thing in the world. She's so proud of wearing it. But here's the thing. Improper backpack usage, or if your child's carrying the wrong backpack, it's not likely to cause long-term permanent damage, but it can cause issues with kids' backs, shoulders, some neck pain. You don't want to do that to little learners. So one thing parents want to make sure is that the backpacks are age appropriate. It's not too big for your child. Things like padding on the back and the shoulders can absolutely help, as can making sure that your child has a waist strap if needed to redistribute some of that weight. Speaking of weight, it's recommended that your backpack shouldn't weigh no more than 15% of your child's body weight. If your child weighs 100 pounds, make sure that backpack does not weigh more than 15%. And also teach your kids proper form. Make sure the bottom of that backpack is right at the lower level of their lower back, and that they're not doing things like we used to do in the 90s, like carrying your backpack on one shoulder. That's not good for your kids' back and shoulder pain at all.
We all walked around like this, didn't we? For God knows how many years. If you were...
I used to do it.
I know, right? If you were to make a back-to-school checklist for parents to try their best to keep their kids healthy, what would be on that list?
All right, I'm going to try to be rapid fire, and I bet you that most parents already go through this in their heads, but let's do it on the fly. I break this up into 3 sections in your back-to-school checklist. Medical, safety, and social. When it comes to medical, think about any underlying medical conditions your kid may have. Make sure your school knows about them. Any prescriptions are sent to your school. Make sure you're up to date with those visits. That includes staying up to date with vaccines and school physicals. And also, your kid should absolutely go to school with some masks, hand sanitizer, sunscreen, and reusable water bottle. Now we talk about safety. You should know your school's emergency plan. Any emergency number should be with your child and the school. Also, bike helmets, please, kids. And last but definitely not least is social. Be aware of your school's social media and device policy. That's important. And have a talk with your children about mental health. Things like stress, anxiety, bullying, and extremely important to spread awareness and start good habits early.
All right, ABC News medical contributor, physician at Stanford Children's Health, Dr. Patel, thank you. Very, very nice. It suits you. It's your color.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.